A simple fall can unfortunately be the start of someone losing their independence. It's a really startling thought, isn't it? But the good news is, it's largely preventable. So in this explainer, we're going to break down the official guidance on how to stay safe, stay strong, and most importantly, stay in control.
Okay, let's just jump right in with the numbers, and honestly, they're pretty staggering. About a third of people over the age of 65 will fall at least once this year. And for those over 80, wow, that number jumps up to half. This isn't just a random statistic. It's a massive public health issue that's kind of hiding in plain sight, and it affects millions of lives every single year.
Because a fall is so much more than just the physical injury. You could almost think of it like a thief. It's something that can steal your confidence, your freedom, and your independence. That fear of falling again, it can be absolutely paralyzing, trapping you in the cycle of not wanting to go out, not being active, and that's exactly why we need to get serious about prevention.
To do that, we're going to follow the official roadmap, step by step. We'll start by really understanding the hazard, then we'll look at how professionals actually find the risk, what a full checkup really looks like, the personalized plans that actually work, and then, the most important part, how you can take the lead in your own care. So first up, the unseen hazard. Let's just bust a really dangerous myth right now. Falls are not a normal part of getting older. That kind of thinking is just, well, it's outdated. We know now that they are a preventable health issue, and it's about time we started treating them that way. This is a huge shift in thinking.
All right, next section, finding the risk. So if falls are preventable, how in the world do we identify who's most at risk? You might actually be surprised to hear that the answer isn't some fancy algorithm or a high-tech gadget. It's something, well, it's a lot more human.
And here it is, a bit of a bombshell really, pulled directly from the official guidelines. Those generic fall risk prediction tools you might have seen online, the advice is don't use them. Why? Because your risk is as unique as you are. These tools can give you a false sense of security, or they can cause a ton of needless worry. And they really just distract from what actually matters, you.
So instead of a tool, the right way to find risk is just beautifully simple and personal. It all starts with a conversation. A healthcare professional should just ask, have you had any falls in the last year? And if the answer is yes, then they take a look at how you walk and balance. It's a logical, person-first approach that just makes sense.
So, what happens if that initial chat and observation raises a bit of a red flag? Well then, it's time for the full checkup, or what the experts call a comprehensive falls assessment. Now, don't let that clinical-sounding name fool you, okay? This is basically a deep dive into your health and your surroundings to figure out all the little hidden factors that could be putting you at risk. It's a personalized investigation, not some one-size-fits-all test. And you can see this assessment is a true 360-degree review of your life. I mean, we're talking about everything from the medications you take and your heart health, all the way to the shoes you wear and the strength in your muscles. It even looks at your home environment. See? It's all connected. Okay, so all that information, all that detective work, it leads to the most powerful part of this whole thing, creating a personalized prevention plan. This is where we turn all that knowledge into real, concrete action.
If there is one magic bullet for preventing falls, this is it. Exercise. But look, we're not talking about a casual stroll in the park. We're talking about targeted programs designed by a professional to specifically build up your strength and improve your balance. It is, by far, the most effective thing we can do.
Next up, let's talk about your medicine cabinet. You know, certain medications, especially the ones that can affect your mood or alertness, can seriously increase your risk of falling. A simple, structured medication review with your doctor or pharmacist can help spot any potential culprits and find safer options.
And third, we bring the focus right back home. A professional, usually an occupational therapist, can come and assess your living space to spot those hidden dangers. You know, things like bad lighting, a loose rug, or just clutter. Then they'll suggest practical and often really simple fixes to make your home safer.
So, let's take a quick look at where these actions are most effective. As you can see from this table here, some things are just universal, like reviewing meds and encouraging activity are crucial no matter where you are. Others, like a home assessment, are a bit more specific. The real key is finding the right mix for you.
Okay, this brings us to the final and I think the most crucial piece of the puzzle. Because this prevention stuff isn't something that's just done to you. It's a partnership. And you are the most important partner in that team. And this is where you come in. The official guidance is absolutely crystal clear on this. You have the right to be an active partner in your own care. Your voice matters. Your preferences matter. Your goals matter. This is your health, and you are in the driver's seat.
So, how do you become an active partner? It's simple, really. Speak up. Share your worries about falling. Ask for choices. Maybe you'd love a group exercise class, or maybe one-on-one sessions are more your style. And definitely don't forget to get your loved ones involved in the conversation. This is a team effort, and you're the team captain.
So there you have it, the official guidance on preventing falls, all broken down into simple, actionable steps. It's really about being proactive, not reactive. And you know what? It all starts with a conversation with your doctor, with your family, and with yourself. So, are you ready to take that first step toward a safer, more independent future?